Testing. Can y'all hear me okay? Charlie, you're good? My? Okay. Um, Yes, sir.
Does everybody know, media all know that we need to...
Yeah,
talk
I told him.
to Davidson
I told him one-on-one. Yeah.
Okay.
Everybody ready? I'm ready whenever y'all are. Good morning, everyone. Welcome to the Music City Center, and it's good to see everybody's faces instead of a screen. We'll begin today's press briefing for COVID-19 with Mayor John Cooper, followed by Dr. Adrian Battle, Director of Metro Nashville Public Schools. Then Dr. Alex Jahangir, Chair of the Nashville Coronavirus Task Force and Chair of the Metropolitan Board of Health. And he will introduce Dr. James Hildreth, President and CEO of Meharry Medical College, and then Colin Reed, President and CEO of Ryman Hospitality Properties, and then Dr. Wright Pinson, Deputy Chief Executive Officer and Chief Health System Officer for Vanderbilt University Medical Center. Also here to help answer your questions will be Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Gil Wright, Interim Chief Medical Officer for the Metro Public Health Department. We'll now begin with Mayor Cooper.
Thank you, Brian. I'm going to stand back and take my mask down for a moment. Good morning, everybody. Yesterday, Nashville commemorated the 1-year mark since the March 3rd tornado, which devastated our city, and this is our 101st press briefing, both in English and Spanish, to address our city's challenges. Now, less than a week after enduring the 6th most damaging tornado in U.S. history, we also had a global pandemic. In a year of testing all of our resilience, Nashville is turning the corner on the pandemic. And starting next week, we will begin Phase 1C, which includes anyone 16 and older with a medical condition that puts them at higher risk. Phase 1C conditions include asthma, hypertension, diabetes, cancer treatment, organ transplant, and others that are listed online at covid19.nashville.gov. Caregivers and other members of households with medically fragile children are also eligible. This is a big phase, and it covers 300,000 Nashvillians starting Monday morning, March 8th. Visit covid19.nashville.gov or call 615-862-7777 to get a vaccine appointment. Now, this past weekend, the FDA authorized Johnson & Johnson's one-shot COVID vaccine for emergency use. This is the same approval given to the 2-dose Pfizer and Moderna vaccines, and it is welcome news. The FDA's approval means we can expect an even larger increase in our weekly vaccine supply as production and distribution ramps up. Next week, we will receive 13,000 Johnson & Johnson doses on top of the 11,500 doses of Pfizer and Moderna vaccine that we have already been allocated. This ramp up and public health's ability to get shots in arms quickly and efficiently make it possible to move on to 1C. Again, to make your Phase 1C vaccination appointment starting Monday morning, visit the COVID-19 website or call 615-862-7777. And now an update on our coronavirus metrics. Today, our 7-day positivity rate is 4.6%, down from 7.5% last week. Public Health reports 1,809 total active cases. That's a little up from 1,614 cases 7 days ago. But it's important to note that the high in active cases in Nashville was 8,531 cases on January the 10th. Our 7-day average of new cases per residence for 100,000 residents is 22.7. The transmission rate in Davidson County is 0.91. This is an increase from last week, which I think was affected by the week of snow that we had, but that is still below our target of 1.0. If we stay the course, we can keep the virus contained. Wearing masks, social distancing, and other healthy habits can save lives and keep our economy open. Now let's review our vaccine rollout. As of today, 14% of our 700,000 Davidson County residents have started their vaccinations, and 7.9% are fully vaccinated, meaning they've gone through the second dose as well. This means that just under 100,000 residents have had their first dose, and 55,000 residents have had both doses and are fully vaccinated. Now, Davidson County has given out 180,000 total doses, and they've been given to everyone who qualifies for vaccine in Davidson County. That number is up 30,000 from 150,000 last week. With the great help of Vanderbilt and HCA, nearly 10,000 teachers and child care workers have had at least one dose of their vaccine. 44,323 individuals in Nashville, or 51% of residents over the age 65, have received their first dose. And as of today, there are openings at the Music City Center vaccination site for all Nashvillians over 65 who want to be immunized. If you are in this age group and need to schedule your appointment, please call 615-862-7777. Now, it's my privilege today to welcome several special guests at today's briefing. Dr. Adrian Battle, Director of Metro Public Schools, is with us to discuss the return of in-person learning and to recognize the hard work of our teachers and our students. And as always, Dr. James Hildreth, President and CEO of Meharry Medical College, is here to talk about this new Johnson & Johnson vaccine and any other observations that he has about public health. The city is always welcome to hear them from Dr. Hildreth. And Colin Reed, Chairman and CEO of Ryman Hospitality Properties, is joining us to provide an outlook on Nashville's hospitality and tourism and our economic rebound. And Dr. Wright Penson of Vanderbilt University Medical Center is here and will address the need for continued public health practices and continued masking and diligence. And I'm grateful to all our guests for joining us today. And with yesterday being the anniversary of the tornado, I want to thank our special community heroes at Hands On Nashville. Nashvillians are known for coming together and helping one another during times of crisis. Hands On Nashville coordinated volunteer efforts in response to every challenge our city has faced in this last year. The generous compassion of our residents has been a common thread throughout a difficult year. In the week following the tornado, 26,000 volunteers signed up to work. That's 4,000 more than we saw in the first week following the 2010 flood. This has become a traditional response in Nashville. And once the pandemic began, over 1,000 people have volunteered at our assessment centers, and nearly 1,200 volunteers have worked at our vaccination sites. I'm grateful to all of them, and I'm grateful to Hands On Nashville and all those who've given their time and efforts to serve our community. After the most challenging year in Nashville's history, the other side of the pandemic is finally within reach, and the start of Phase 1 marks the beginning of a new chapter for our city. But please, let's keep wearing masks, avoiding crowds, as more Nashvillians get vaccinated, and I'm grateful for everyone who's doing their part to help fight this virus and return Nashville to normal. And let me now turn this over to Dr. Battle, Director of Metro Public Schools.
Thank you, Mayor Cooper, and everyone for being here today. Throughout this pandemic, our teachers and our staff have been working hard to find new, creative, and unique ways to address the social-emotional learning needs and academic needs of our students and the families that we serve. Our families and students have shown resilience and a tremendous ability to adapt to challenging circumstances. As of yesterday, more than 30,000 students have walked into school buildings, some for the first time this school year. Make no mistake, throughout this pandemic, they have been learning, engaging with their teachers, their counselors, their principals, and other staff to continue learning in the virtual learning environment. For some families, the right choice for them is to remain virtual through the remainder of this school year. And we will honor our commitment to ensure we do everything possible to meet the needs and provide them as enriching a learning environment as their face-to-face peers will receive. For those who returned in person, we're committed to doing our part to keep them safe through protocols and procedures that will reduce and mitigate the spread of COVID-19 in our school buildings. I would urge everyone to please heed the warnings of the CDC director. Now is not the time to let down our guard and pretend the virus has gone away. The situation has improved, and we should celebrate our collective work to get there by continuing to wear our masks, social distance whenever possible, and get the vaccine when it is available to us. That is how we will stop the virus. That is how we will return to a sense of normalcy. That is how we show that we care about the children in our community. As of yesterday, more than 7,000 staff throughout MNPS and our charter schools have received their first dose or scheduled their vaccine through our partnership with Vanderbilt Health, and thanks to the commitments and support of Mayor John Cooper, Dr. Alex Jahunger, and the Metro Public Health Department. That 7,000 is in addition to the hundreds of staff who had to drive out of county to receive the vaccine. As we move into the final quarter of the school year, we will do everything we can to ensure those students who have chosen the in-person option can remain there. We're also developing plans to offer some of those traditional high school experiences, such as prom and graduation, in an in-person setting, while keeping the health and safety of everyone as our focus. Finally, we're working to finalize our summer learning program in the coming weeks, which could potentially have the largest attendance of any summer school program in our history. We have been making plans since last year, but we are having to make some adjustments based on the legislation passed in the brief special education session earlier this year and in accordance with the rules and guidance provided to us from the Tennessee Department of Education. Families, staff, and students, please stay tuned for further details on what this will look like and how you can sign up to attend. Once again, thanks to everyone for helping MNPS ensure a safe return for our students to the classroom. And with that, I would like to turn it over to Dr. Alex Jahunger to come up to the podium.
Thank you, Dr. Battle, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. Number of active cases have increased 195 since our last update. Last week was the lowest we had seen in over 4 months. We are now in a much better place for active cases than we have been in the past months, and we continue to see improvement. Total cases are now at 90,336, with 209 of those cases coming from yesterday. A rolling 14-day average of new cases is 131, a drop of 25 since last week. And our 7-day average of new cases per 100,000 is at 22.7, making this metric yellow on our dashboard. And the transmission rate is at 0.91, which is a little bit of an increase from last week, but it is still below 1, which means that every person who gets this virus spreads it to less than one person. Now, COVID hospitalizations in our region also continue to improve. In Middle Tennessee, we now have 301 individuals admitted with COVID, down from 341 last week. And in Davidson County, 198 individuals are admitted with COVID-19, down again from 218 the week before. Now look, we're here at the Music City Center this morning. A little less than 1 year ago, I remember being in this exact building, Mr. Stark, who's back there today, and we were planning a mass casualty hospital with room for 1,000 individuals to be admitted right here in the Music City Center. What a year it has been, but today I am so excited that we're here in the Music City Center, which is playing a huge role in ending this virus in our county by serving as the centerpiece of our vaccine rollout. So far, 97,416 Nashvillians have received their first dose of the vaccine. That is close to 19,000 more than just last week. And more than 55,000 Nashvillians have been fully vaccinated, meaning they've received their second dose, which is 8% of our county's population. Now, we are finishing vaccinating the teachers and the staff in Phase 1B, and as noted, Monday we'll be moving to 1C. Now, 1C is for any individual over the age of 16 that has any of these following medical conditions: chronic renal disease, COPD, pulmonary fibrosis, or moderate to severe asthma; obesity, meaning your BMI is over 30; heart disease, hypertension; you've had a stroke; dementia; liver disease; sickle cell anemia. Also in this phase is anyone that is immune compromised, including those on chemotherapy, those requiring daily steroids or daily medication for diabetes, those who have HIV/AIDS or who have had a transplant. Also, household members of those taking care of people under the age of 16 who are considered medically fragile, as well as anyone who's pregnant, are also included in 1C. Now, as you can see, this is a really big category, and I'm so grateful to Commissioner Lisa Piercy for moving the state forward in the phasing and giving us the vaccines that are now coming to us to make it possible for us to vaccinate so many Nashvillians. We have also been making great progress on those residents over 65. In fact, of all those individuals over 65 years old here in Nashville, 51% have received at least one vaccine. Furthermore, 44% of whites over 65, 33% of blacks over 65, and 40% of people of Hispanic ethnicity over 65 who are Nashville residents have been vaccinated. Appointments for our city site can be made by going to covid19.nashville.gov or by calling 615-862-7777. Appointments for 65 and over in the previous phases are open now, and beginning Monday you can apply for Phase 1 or 1C. Also, as a reminder, vaccines are available in Davidson County and many other locations. Health systems, including VUMC and the Veterans Administration, clinics such as FQHC and Siloam Health, Meharry Medical College, pharmacies around town, including Walgreens, Walmart, and Kroger's, all have availability and each have their own process for applying for those vaccines. Now, tonight at 6 p.m., there will be a town hall hosted by Deputy Mayor Haywood, State Representative Love, and Dr. Joanna Shai-Kai of Metro Public Health. Visit covid19.nashville.gov to learn about this town hall, and there will be some great information shared about why this vaccine is important. All of the vaccines have been shown to be safe and effective, so don't get worried about getting a vaccine. Get whichever one comes to you first. In the clinical trials, 100% of individuals who received the vaccine were not hospitalized, nor did they die. That is why we're seeing more people get vaccinated. So when it's your turn, get the vaccine. This truly is our end game to move beyond this virus. But until you get your shot, continue doing what you're doing. Social distance, wear a mask, and if you have any concerns about getting infected, get tested. And if you test positive, look into getting monoclonal antibodies. That could very well save your life. Now, as this is our 101st press conference, and we're here together in person, I would like to take a minute to personally thank Mayor Cooper and his staff, members of the City Council, Dr. Hildreth, Director Chief Swan, Chief Survey and all the men and women of the Office of Emergency Management, Dr. Battle and her team, as well as the private and parochial and charter school leaders who've worked together to get this, and all of our city's healthcare system leaders and leaders such as Dr. Pinson, Mr. Adams, Mitch Edgeworth, Heather Ohan, Dr. Joe Webb of Nashville General, and the entire team at Meharry Medical College, especially Dr. Julia Gray, who's been so instrumental in our community assessment centers. And of course, Dr. Wright and Tina Lester from Metro Public Health. I'm grateful to all of you. And finally, I'd like to thank all of Nashville. We have continued to come through a lot, and we're at such a good place. It's not time to take our foot off the gas by any means. Push forward hard, get vaccinated, and be very vigilant, and we will soon see the end of this. With that, I'd like to introduce you to Mr. Reed. Thank you.
So I can read my... Good morning, everyone. Now I can see again. Thank you very much, Mr. Mayor, for inviting me to join you today. It's difficult to imagine that this time last year, almost exactly, I was sitting in an investor conference down in Fort Lauderdale, the Global Citibank Real Estate Conference, getting peppered by investors as to what the impact of this little virus that had just shown up in the Northeast called COVID was going to do to our company and going to do to our industry. And what a year it's been. This pandemic has disproportionately impacted the hospitality and live entertainment business across this town and across the country when compared to other sectors of industry. To put this in perspective, my company, Ryman, went into 2020 expecting to generate about $500 million of EBITDA, and at the end of December, we had an operating loss of $100 million. COVID cost our company about $600 million. And I know there are many hospitality owners and professionals out there in our community who have felt the pain of this shutdown personally and professionally, who are ready to get back to the meaningful work they love. And I suppose when I add it all up, the folks in our company who are still sitting on the sidelines waiting to come back to work, they number today about 1,500 people. Now, notwithstanding all of that negative news, I want to share a message of cautious optimism because I do honestly, truly believe brighter days are ahead. And I think organizations and cities have learned from all of this debacle that we have gone through. And I think our company and I think our city, our industry, hospitality industry, is going to emerge much stronger. Now, despite the challenges that we have faced as an industry, I believe that we as a city have fared better and will continue to fare better than many other cities around America. Our fundamentals are sound, and we are a destination that folks want to visit. And while we're not yet out of the woods, as Dr. Yohunga just said, from a public health perspective, I fundamentally believe we are at the beginning of what will be a very robust recovery in our industry and for our city if we do things right from here out. We have a tremendous opportunity to capitalize on the pent-up demand for travel by consumers around the country and around the world in the months ahead. And you know, if you think about it, most of America have been locked up in their basements, trying to figure out when they can get out and do things. And I really truly believe, from all the research our company does, there is a tremendous pent-up demand here. Nashville sits sort of as a central location within the United States of America, and it's within a day's drive of much of the US population. And with the increasing airlift and the work that's being done at our airport, we're in a prime position to provide an entertaining outlet for tourists. Now, let me just give you a couple of statistics, and these are hot off the press to illustrate demand. Since the pandemic struck, every week our company have been live streaming the Opry on a Saturday night. And on average, 1.8 million people have come in every week to live stream the Opry show from all across America and outside of America as well. About 110 countries have tuned into the Opry. That doesn't include what we carry on Circle. But the other interesting statistic that I find very interesting, over the last couple of months since we've opened up the Opry to live audiences, albeit 25% of the House, about 1,100 people. 85% of the folks that have sat in the Opry House on a Saturday night in the last couple of months have come from outside of Tennessee, with the big three states, California, Florida, and Texas. Now, remember, this has been in the height of the pandemic, and I find it extraordinary that people will want to travel 4 hours on an aeroplane with all of the risks associated with all of that to come to this city. And I think that illustration shows what people want to do here. Going forward, both the challenge and the opportunity is that as the vaccination program rolls out across our nation, and as consumers become confident to travel, we as a city must send a strong message to the music fans all over America that we are open for business, and if and when they come here, that we have their safety at the core of everything we do. And as an industry, we applaud Dr. Yohanga's comments just a second ago. We encourage all of our hospitality workers in our company to be vaccinated when vaccine is available. And I'm probably violating HIPAA here, right, when I say what I'm about to say. I got my second vaccine 24 hours ago at Vanderbilt. It was a very pleasant experience, and it was relatively painless. So thank you very much indeed for the work you're doing there. From the beginning of this crisis, our company has supported Metro Health and this administration in their efforts to protect public health in this city through a balanced approach to operating safely until such time that COVID no longer presents a grave health risk. We look forward, I personally believe concise communication over the next several months will become even more critical. Why? Because as companies, associations, and leisure tourists make their choices as to where they want to visit, and as they plan for those visits, they must be able to understand what is going on in this town. So we have to be, I think, as a city, a very good communicator outside of this community, and let people know that when they come here, it is a safe and secure environment for them to have fun. So we look forward as an organization for the restrictions to be falling away over the next few months, and I really do truly believe the Music City brand remains extraordinarily strong. But our other competitive advantage is our willingness to work together for the greater good of this city. Just as we did in the flood of 2010, our city will come back stronger from this crisis that we've been living through. And if we work together with our partners at the city, the state, the industry, I believe that the future looks extraordinarily bright. And we as a company, Ryman, look forward to playing our part in restoring one of the great destinations on the planet, Nashville. Thank you. It's now my pleasure to introduce Dr. Hildreth.
Good morning, Nashville. About a year ago, in the wake of the devastation of tornadoes, we were confronted with a truly historic public health crisis, a pandemic that threatened our way of life and threatened the lives of hundreds of thousands of us. I was one of the scientists who believed that science should guide our response to COVID-19 and that science would deliver effective solutions for the pandemic. Many health professionals, including myself, strongly recommended a national coordinated response to COVID-19 because the virus that causes COVID-19 does not respect borders, city borders, state borders, or continental borders, and human beings are the vectors that transfer the viruses between these places. Furthermore, we understood that the risk of COVID-19 was not evenly borne by population groups in our country, and that the best approach to saving lives was to focus on the most vulnerable. Unfortunately, the coordinated national response did not happen, nor was the focus placed on those most vulnerable to disease. And as a consequence, tens of thousands of unnecessary lives have been lost because of that. Fortunately, science did deliver. And last December, less than a year after the pandemic began here in this country, 2 safe mRNA vaccines from Moderna and Pfizer were being injected into the arms of thousands of us. This past Friday, a 3rd vaccine from Johnson & Johnson was granted approval for emergency use by the FDA. And thanks to a purposeful, focused, and coordinated national leadership, the real prospect exists that by the end of the summer, any adult in this country who wants a vaccine will have an opportunity to get it. Since 1978, I've been researching and teaching about immunology and viruses, and I've had the privilege to serve on the FDA committee that reviews the vaccines for approval. In that context, I'd like to share a few perspectives with you about the COVID-19 vaccines. All 3 vaccines were subjected to a rigorous evaluation across many continents, applying the principles of science to those studies. And tens of thousands of volunteers made it possible. And to those tens of thousands of individuals, we owe them a tremendous debt of gratitude. All 3 vaccines were found to be safe and well tolerated in people of all races, of ages 16 and older, and very importantly, all of them were effective in individuals with pre-existing chronic conditions. Those of us who do research on viruses and in public health would have been very excited to have one vaccine with an efficacy of more than 50%. So imagine the excitement of having not one, but 3 vaccines with an efficacy greater than 60%. The J&J vaccine showed 66% overall efficacy against severe to moderate disease across all countries 2 weeks after vaccination. It had 72% efficacy here in the United States and 85% efficacy against severe COVID-19 starting at 28 days after vaccination. It is really important to note that these efficacy levels for J&J were achieved in countries where variants were highly prevalent. For example, in South Africa, where the B.1.351 variant accounts for 95% of all the infections. But the most compelling data for all of these vaccines, including J&J, is that all of them offered complete protection against hospitalization and death. And that's the most important thing we're trying to achieve with mass vaccinations, preventing disease and keeping people alive. The J&J vaccine is very important for a number of reasons. First of all, it's a single shot, which drastically simplifies logistics of getting lots of people vaccinated. And furthermore, it accelerates the time we'll get to achieve herd immunity. It can be stored and transported under regular conditions of the supply chain, which makes it easier to use in vulnerable populations and in rural settings. It is important that everyone understand that this vaccine is not an inferior one. And if it had been the first to be approved for emergency use, believe me, the excitement for the J&J vaccine would be equal to, if not greater than, the mRNA vaccines. So I encourage all of you to take whichever vaccine becomes available to you, because the goal is to get everyone vaccinated as soon as possible. This is even more urgent because there are now variants of SARS-CoV-2 circulating, which appear to be more transmissible. And the longer the virus has a chance to be transmitted in our communities, the risk becomes really great that a variant will arise that completely escapes the vaccines. And that's the last thing we need, is to start over. So, until you're vaccinated, it is imperative that all of us do the things we've been doing to keep the virus in check. There's a real sense now that we've turned a corner and we're edging ever closely to putting this horrendous public health crisis in our rearview mirrors. But there is still work to do. We absolutely must not stop taking the steps necessary to prevent the spread of the virus. Large segments of our population remain vulnerable to COVID-19, and many of them are at high risk for disease and death. So Nashville, let's finish strong by minimizing further disease and death in our community. And we do that by masking up, looking out for our neighbors, protecting our communities, and whatever you do, whenever the vaccine is available to you, please take it. So Nashville, we've got this. Let's mask up and protect our communities and ourselves. With that, I'd like to introduce my colleague, Wright Princeton from Vanderbilt University Medical Center.
Good morning, and thank you, Mayor Cooper, for the opportunity to represent Vanderbilt University Medical Center this morning. As others have commented, yesterday we recognized the one-year anniversary of one of Tennessee's deadliest tornadoes, an event that brought so much fear, loss, and grief. Today is also another important milestone as the Tennessee Department of Health announced just a year ago the state's first confirmed case of COVID. For our health system, like others, our COVID command center has been in continuous operation now for a year. The center is comprised of leaders from all the divisions in our institution who are responsible for managing our response to the pandemic in a fashion that allows us to also continue to serve all the other patients. We often speak in that center of resilience. Resilience is a hallmark of Nashville's success in getting through this pandemic. And it's a trait that's allowed us to respond to the other challenges in the past year and to challenges over the many years. We do this very well. Now, the COVID vaccine is having its impact, and things are getting better. And we are moving in the right direction, and I encourage everybody to take that vaccine. But now is not the time to drop our guard on the other important infection control measures. Sticking to the safety measures that got us here continues to be essential while the vaccine becomes more available to more people. And I just want to reiterate, those measures are not only taking the vaccine, but wearing a mask. Masks work to avoid spreading an airborne respiratory illness. Continue to keep 6 feet apart from others who are not part of your household. Avoid large crowds and practice frequent hand washing. I want to close my comments by adding that Vanderbilt University Medical Center has been very proud to work with Metro Public Health Department and Metro Nashville Public Schools to vaccinate its teachers and staff. And we look forward to continuing opportunities to work with Dr. Gilwright, Dr. Jahanger, and the health department to expand vaccination efforts. Thank you very much. Brian Todd.
Thank you, Dr. Pinson. We'll now begin asking questions. I ask that each reporter or photographer address the questions from the microphone there. We can start with Dennis Ferrier. Okay, thank you, Dennis. I know that Dr. Battle had to take a call. She had to step away, but I know Sean is here, if he can address it.
Thank you, Dennis. We really appreciate Meharry Medical College stepping up to support our schools and make sure that we can reopen safely. So we carefully worked with them to make sure that the scope of work was reasonable and that the contract is up to $18 million. It is not guaranteed $18 million, and so they'll have to show their work to make sure that they get paid. But we think that the testing component, we think that the support for schools is essential so that we can safely reopen and bring all of our students back. And so we went through all the legal processes necessary, and so it's a valid contract. been reviewed by multiple parties, including Metro and MMPS, and so we stand by that. As for the substitute question, substitutes are a challenge in a normal year, and so we continue to encourage people to sign up. You can go to mmps.org/careers. In addition to assigning substitutes to each school, we have one assigned to each school on a regular basis. We also have had central office employees assigned to each school. So every central office employee is assigned to one school, 1 day a week. Thank you.
Dr. Hilder.
The contract with the schools is through Meharry Medical College Ventures. It's an LLC we started to facilitate taking swift actions to partner with other entities. So it's a for-profit entity owned by Meharry Medical College to facilitate the kinds of partnerships that this represents. Does that answer your question? Many not-for-profit organizations have for-profit LLCs to facilitate transactions and partnerships where business decisions have to be made swiftly to make sure the work can get done, and that's why we did it that way.
Thank you, Dr. Hildreth.
Marissa from Chapel. Okay. Sean will.
Thank you. So the in-person graduation plans, we are still working with schools to further develop that. Each school will sort of have their own plans, but we've put in the broad strokes of that. So we will be welcoming, as long as we continue on the current direction, we will have in-person graduations similar, but obviously we'll try to reduce capacity to make sure that we meet guidelines. And the second question was, the summer learning experience that we're going to be working on. We're trying to conform our plans that we have been developing to what the state legislation that passed, but we'll be offering it to any no cost to any student that wants to attend K-8 or K through 12, and it'll be in June, and we'll be announcing more details about that next week. But it'll be very extensive. It will be funded by a portion of state and federal stimulus dollars, and so we look forward to offering that to any student that wants it. It will be a large attendance this year because we know that there's a great desire and need, and also there's state legislation that sort of requires a certain offering it to any student that meets certain qualifications, but ultimately we were planning to offer a very robust experience for the past few months, and there are definitely students that want to continue learning throughout the summer, and it'll be in person, and we look forward to that.
Thank you, Sean. Yi Yoon, Tennessee. Could you're socially distant. Can you move that down, and so I can't hear you very well. Okay. Thank you. Thank you.
Thank you so much. No, we're not going to require documentation. I think there's several reasons for that. First is equity and access. We're hoping that the people of Nashville continue to do what a majority of people of Nashville have been doing for the past year, is to be a good citizen, a good neighbor, and if they fit Phase 1C, then they will come and sign up for Phase 1C. But at least at our city sites, we're not going to obligate demonstrating the need, but we're asking that you have the honors code and you do it, because again, we want to make sure everyone who needs it gets it, and we don't want to put up any undue barriers that can be put up. We don't need to do that. We need people to get vaccinated, period. But thank you, and welcome to Nashville. Yeah. Yeah, so there obviously is strategy about how the vaccines are deployed. Here at the Music City Center, more likely than not, we will continue with our Pfizer and occasionally Moderna, because here's the thing: those vaccines require cold storage. There's a whole process that you guys have covered very effectively, and we're able to do it when we're in this facility. Now, with Johnson & Johnson, which is a single shot, which does not require the super cold storage, there hopefully will be opportunities to deploy them at pop-up events, at maybe mass vaccination events, which we're thinking through right now, and so and maybe be able to do it in a way that people may be more challenging to get them to get a second dose to get the first dose. So all of those things are being thought through. More information about some of those things I sort of alluded to in the weeks to come. But yes, we're going to deploy all the vaccines we have in this city as quickly as we can do it in a safe fashion. So thank you.
Are there any other questions? Okay. Good morning, Charlie. Thank you, Charles.
Yeah. So the question is around vaccine volume and capacity. We've been very grateful with the partnership with the state and honestly with the federal government to get vaccine supply at a constant, stable, and hopefully continuing to be increasing rate. Obviously, we always continue to watch that. I'm grateful for the partnerships. Dr. Pinson mentioned some. VUMC has been an amazing partner to us in this distribution. The Meharry Medical College, another great partner, FQHCs. As we get more and more vaccine, we distribute them to our partners as well as what we do here at Music City Center and other places. And there's what I wanted to highlight, the message I don't want lost from today is there are slots open right now to get a vaccine. If you're in phase today, covid19.nashville.gov, 615-862-7777, get a vaccine. And come Monday, if you're in phase for 1C, do the same thing. We have spots, thus we have vaccine. And we hope that continues, and if for some reason there's an issue with the supply at some point, you'll be the first to know. So, but we have it right now. Thank you.
Thank you, Dr. Jahangir. If there are no other questions, that will conclude today's press briefing. Just so you know, the next COVID press briefing will be next Thursday, March 11th at 9:30 a.m. and that will be a WebEx, and it will feature Dr. Jahangir and Dr. Wright. So thank you for joining us for today's briefing.